We studied COVID-19 in pregnant women in Washington State, and we partnered with 6 hospital systems that represent 15 hospitals in Washington State. And within those hospital systems, they capture 40% of all the births in Washington State. The first thing that surprised us when we looked at these cases was that 1 in 8 women were hospitalized and 1 in 7 women had a severe COVID-19 infection. When we found cases of infections in pregnant women, we looked immediately to try to identify whether it changed the outcome of their pregnancy. And in 1 in 4 cases, the decision to deliver the woman was influenced by her diagnosis of COVID-19. And in 1 case, it resulted in a very preterm delivery at 33 weeks, which is almost 2 months before her due date. Preterm birth can impact the development of the child, the health of the child, as well as the well-being of the entire family when the newborn is hospitalized for months at a time. The most significant finding from this study was that the pregnant women with severe infections were typically overweight, obese, and had other underlying conditions prior to pregnancy, like asthma or high blood pressure. We think that these are very significant risk factors for severe COVID-19 disease, and that women that are in these categories need to take extra precautions in the time of this pandemic. You can imagine that a pregnant woman in late pregnancy already has a baby that is taking up most of her abdomen, and that is also putting pressure on her lungs. If you increase the burden on her lungs by both obesity and a pneumonia, you can see how those 3 conditions together can synergistically potentially make her disease much, much worse. Pregnant women need to know that they represent a special and high-risk group for COVID-19 pneumonia. We would like them to take extra precautions in terms of staying at home, washing their hands, wearing cloth masks, and being very careful when they do need to go out to wash their hands and not touch their face. We're also concerned about all the people that surround those pregnant women, that they take those same precautions when they can. Our next step is to create a larger study and cover more of Washington State. My goal is to study at least 80 to 90% of pregnancies within Washington State for COVID-19 infections to determine really for the first time on a statewide basis what is the impact of COVID-19 on our pregnant women, and what can we do to prevent this. We'd like to work with all of our partners and even expand sites in Washington State so that we can better identify pregnant women with COVID-19 and assess which parts of the state have higher rates and what is the kind of public health messaging that we need to work on to better protect pregnant women.